Changes to swallowing, communication, and ability to think can occur as a result of a stroke. Speech-language pathologists and communicative disorders assistants are members of the stroke rehabilitation team and will find ways to help you and those supporting you manage these changes as you recover. A stroke can affect the muscles in the lips, tongue, and throat that we use to eat and swallow. When these muscles are weak or uncoordinated, changes can occur in your ability to safely eat and drink. Swallowing difficulty is called dysphagia. Dysphagia may cause food or drink to go down your airway instead of the tube to the stomach and may cause problems like pneumonia. With dysphagia, you may also have difficulties chewing or clearing food from the throat or mouth, especially on the weaker side. Coughing, choking, throat clearing, or a sensation of food sticking in your throat may occur. If it is not safe to eat or drink by mouth, you may be fed through a tube until it is safe again to swallow. So, what can be done to make swallowing safer? Food can be chopped or pureed. Liquids can be thickened to allow more time to swallow. You and those helping you can learn how to prepare foods and drinks into safer textures. Swallowing exercises may also be recommended to help strengthen your ability to swallow. At mealtimes, shut off the TV or radio to focus on your meal. Sit upright when eating and drinking, and for at least 20 to 30 minutes afterwards. Eat and drink slowly and take small bites and sips. Swallow all the food in your mouth before taking another bite. Use your tongue to clear out food on the weaker side of your mouth. If you are helping at meals, sit at eye level. Place the food close by to encourage the person to feed themselves if possible. If someone is too tired or not alert, it is better to wait and eat later. Medications can make you less alert or lead to a dry mouth, making swallowing more difficult. Talk to your doctor if you think medications may be affecting your swallowing. Be sure to brush your teeth, gums, and tongue, especially after meals. A clean mouth can help prevent lung infections if you have swallowing problems. Changes to communication can also happen after a stroke. You may have difficulties speaking clearly, saying what you want to say, or understanding what others are saying. You may also have challenges with reading and writing. A stroke can change the strength and coordination of our face, lips, and tongue. This can make your speech sound slurred, weak, or too slow. This is called dysarthria. You may have difficulties planning the movements needed for speech. Talking may have many stops and starts, and in some cases, no sounds come out. This is called apraxia of speech. A stroke can also affect the areas of the brain that control language. This is called aphasia. With aphasia, you may have difficulty finding words or making sentences, reading and writing, or understanding what you hear. Aphasia means that you have difficulty with language, not with thinking or decision-making. Changes to communication can be frustrating, as day-to-day conversation may now be difficult. Often, you know what you want to say, you're just having difficulty getting the message out. There are many things that you, your caregiver, and friends can do to make communication easier. Give yourself time to communicate. Try other ways of getting your message out, such as writing, drawing, pointing, gesturing, or using a communication board. Use another word to say it in a different way. If you are a friend, family, or caregiver and want to help someone to understand what is being said, Use simple language and speak slowly. Repeat what you are saying. Use gestures, objects, draw pictures, or write out keywords. Clarify when you're starting a new topic. And be sure to check back that the person has understood. If you are not sure what the person is trying to say, ask simple questions that involve a yes or no answer, or give a few choices. Tell them what you did understand. It's okay to try again later. They will appreciate the effort. A stroke can also affect your ability to focus, think clearly, learn tasks, and remember new information. These changes to thinking skills can affect your ability to have a conversation. Therapy can help you find ways to manage these changes and stay engaged. Some find it helpful to join community groups or programs to practice communication with other stroke survivors. Understanding how a stroke can affect communication is important in helping to reconnect with loved ones and friends. Work with your speech-language pathologist and healthcare team to identify the best ways to support your communication and swallowing. Be sure to check out the next video in the series, Adjustment After Stroke: The Patient and Caregiver Experience.